So what the vestibular system is, it's our inner ear system. It's kind of like our body's own personal leveling system. I describe it to my patients. If you think of a level that has the bubble in it, and you move the level up or down, and that bubble floats. Well, our inner ear system works much that same way. There are a series of semicircular canals, so some circular shaped canals that fluid floats around in. There are some hair cells or some receptors that line those canals and monitor that fluid movement. And that movement, when we change positions, when we turn our head, when we go from sit to stand, when we get up out of bed, anytime there's a change of our body position or our head and neck position, that fluid moves. Our body senses that movement, and it gives our brain information on, what's up, what's down, are we moving fast, are we moving slow, are we turning, is something spinning around us, those type of sensations. You can relate to this if you're ever on a ride at an amusement park that spins and you get off it and you feel like you're still spinning. Well, that's because that fluid gets moving and it takes a minute for it to settle down, and sometimes it can give us that feeling of nausea or not feeling so well also. And that's the type of symptoms that some of our patients feel when their vestibular systems aren't working correctly and they're very sensitive. So because our body interprets all of these different systems, our inner ear, our vision, our ability to balance, those type of things, our evaluation is going to test all those systems. So usually when a patient comes in, we'll start with some very simple balance tests. Just some static standing tests where they're standing still. We'll test them with their vision and without their vision, so with their eyes open, with their eyes closed. We'll also test them in those balance exercises with changes of head position, because we know that changes of head position will affect that vestibular system as well. So we'll do head and neck movements while they balance, just to find out what particular movements or changes of position trigger the patient's symptoms. Once we know what the triggers are, that helps us organize a very specific treatment plan to address those specific deficits for each individual patient.